The 5th of June brings the series of Insights over Lunch to a close. This series of lunchtime conversations intended to capture insights from some of society's thought leaders, given the unprecedented times we live in. Part of my role at Warwick University is to make sure our programmes remain relevant and continue to serve the needs of society. To do this, it's important to be part of the research and industry community. The people I will speak to in this series and have spoken to in this series form my professional network, and I rely on them to inform and help steer our educational offerings. We've seen seismic shifts in all areas of life. The extraordinarily pervasive nature of COVID-19 will have lasting effects. To discuss this, my lunchtime guests today are Stuart Bestwick, Head of Service Design and Improvement at Hampshire County Council, and Mike James Moore, who built his career at Land Rover, Director of Manufacturing and Director of Industrial Engineering, joined WMG in 1995, and who I've had the pleasure to work with and learn from since I joined some 20 years ago. Now, Mike is retired and dabbles in the occasional consulting. Welcome to lunch.
Thank you.
Can I start by asking Stuart, what services does Hampshire County Council deliver? And can you give us an indication of the scale of the council and your role within it?
Hi, yes, thanks for the invite. So Hampshire County Council is one of the larger councils, county councils in the country. It's got a revenue budget, sort of like a turnover of 1.7 billion a year, and it employs directly roughly about 13,000 people. That's not including the people in the schools. If you include schools, that takes it up to around 40,000, I think, is the current number. And the services, it's such a diverse organisation. About half of the budget is spent on adult services, as you probably imagine. A quarter of the budget on children's services, which are fairly similar. So lots of community teams, lots of help for vulnerable people, and working with also providers to support and to deliver services out in the communities. And then the last quarter of the budget is split between something that you traditionally see within councils of highways and recycling, and then the other bit is around parks, libraries, and outdoor centres, with a little bit left over for running the corporate centre. But it's a fairly complex organisation, probably the most diverse and complex organisation I've ever worked in. You've got different cultures within all of those departments. So if you compare engineers with social workers, for example, very, very different backgrounds and paradigms that they work in. My role, I joined 3.5 years ago coming from industry and the private sector as a management consultancy. And they asked me to set up an internal practice, or to help establish an internal practice to help the organisation with its transformation challenges. So as you can imagine, we've taken 580 million out of the budgets over the last 7 or 8 years, and we've still got further challenges ahead in order to be able to keep up with the cost of inflation. But
what do you think the main challenges? So those are great results, and it's a big challenge. What do you think is the biggest thing that you need to address within effecting those changes? You know, is it about clear plans, or is it about communicating, or is it about teaching tools to people to help them redesign things? What do you think is the main, or is it just a blend of all those areas to be able to effect the change?
One of my favourite words is it depends. So because we've got so many different departments, and they're at different stages in their transformation process. And part of our role is skills transfer. So we've developed a very loose, lean Six Sigma green belt for the public sector, which has helped them approach some of the process and service redesign. We also do change management and project management training to upskill the frontline team so that they can do more and build it into business as usual. There's usually a big cultural element to it as well. We were very fortunate before COVID in rolling out hybrid devices, and we were all getting familiar with Office 365 and SharePoint, but not as fast as we could have been across the whole of the organisation in using things like Teams and more virtual use of meetings, for example, to cut down on travel. But obviously that's accelerated it. So in many ways, it's been an advantage.
How has the pandemic, how has it affected the services that Hampshire County Council offer? What are the impacts?
It was quite profound. We are obviously used to emergency planning for all their sorts of various reasons. So we have the usual bronze, silver and gold command meetings set up. Everybody knows the rules and they're set up to function. We had on paper plans to deal with an outbreak. But of course, those plans on paper, when you design them based on not knowing what the reality is going to be like, we struggled to start with in terms of being able to respond. Forecasting and predicting was very, very difficult, and we were having to rely on it. The way we reacted was to be very disciplined, and we waited to follow and see what the guidance was from the government. And within the organisation in the background, we were quickly adapting the services so that they could continue to deliver in lockdown. Obviously, a lot of the services are still frontline, but some of the services have kind of been mothballed. Others have continued, so highways obviously have carried on. And some of the waste recycling and disposal has carried on. But adults and children's services seen an increase not only in demand but also complexity, and having to deal with that new way, the way that we work and the way that we engage with people. And again, some of the adoption of technology, we've had successes working with children and families and care leaders, where before getting them to use technology to keep in touch was slow. That's really accelerated because they can see the value of it and they've maintained the contact.
Yes, gosh, right. I'm going to come back and unpick some more of them because that's fascinating. Okay. But Mike, may I turn to you and ask, in your time of the senior leadership positions at Land Rover, did you ever see a kind of a shock of this scale or this kind of magnitude in your time in those positions?
Nothing of this sort of magnitude, I don't think. I mean, other than British Leyland sort of going bust and Sir Michael Edwards' new working plan. I was industrial engineering director for the whole of DL Cars at the time, prior to moving to Land Rover. The one rather small example, I suppose, which personally hit me, I was responsible in my job at Land Rover of closing down the 21 Land Rover factories and putting them all onto the Solihull site in a period of 2 years on a very limited budget. And one of the key issues, we had an old paint shop at Land Rover, which used to do the SD1, and we needed to, in order to build the cars, we needed to turn it round backwards and set it up to paint 4x4 vehicles. And one of the jobs that I had to do was, of course, choose a contractor to do this work for us, which we did. And I always used to stay at the plant during the annual breakdown. And 3 days after the holiday started, where there's pretty well everybody away, the contractor suddenly rang up and said, "Sorry, not doing the job." And it needed to be started, in 10 days' time.
Yeah.
So, because my career had been really in manufacturing, my experience of dealing with contracts and contractors and so forth was limited in terms of, so I managed to get the purchasing director off holiday, get him back, get a hold of one of them. There's fortunately only 3 companies in the country who could do the work. Get them together and get a contract set up, ready to run 10 days later, which required a lot of flexibility. We didn't have the technology in those days for talking to people. I mean, all you'd got really was fax and telephone, because it's a long time ago. And it was quite surprising. I mean, we actually got the 2 alternative contractors together. Well, I've never done that before. And said, what could you do? How could we do it? And we've got a plan, but you do it differently. And we got them together with our purchasing people, and in that 10 days, we did something which normally took about 6 months, I suppose. And flexibility, and it's interesting how you can get competitors to work together.
Yeah.
Mike, able to identify? Sorry, Mike.
It's okay.
Were you able to identify how you were able to speed up that decision-making process and that collaboration? Because that's something we're seeing throughout the COVID lockdown as well.
I mean, the truthful answer, Stuart, is no, other than when talking to the competitors, they could see the need, they could see the pressures on Land Rover, whichever company was in, or they both got joined in the end. They were prepared to change because they saw the pressure. Land Rover, we'd have gone bust if we hadn't been able to pull that off. So we didn't do anything, or I didn't do anything specifically to try and encourage that. It was just a gut feel. I've got to get everybody together who might be able to help, and see if they put the problem to them and see if they were prepared to play ball. And the answer was they were, much to my surprise.
And you can see that. You can see that in the pandemic, that there really is, now that things are starting to opening up, this feels a more uncertain and a more challenging and a more friction in this period between all sorts of different things. Whereas when we were asked to lock down, I think the nation understood this is why we need to do it, and we could all action and find ways around it to make it happen. But now feels like a more uncertain and more challenging time that we're going through as we try to edge our way forward with all the different elements of friction that there will be between supply chains, relationships, competitors, companies, and they're all services. They're all going to have slightly different agendas, priorities, and move at slightly different paces. Could I just return to Stuart just to say, that particular instance? Do you have any? What examples do you have? Examples that you could share of where you addressed something very rapidly in the lockdown?
Yeah, so there's several things. There was some which were parts of projects where we'd already got established timelines, and we were thinking that was a reasonable amount of time to make things to happen, and other things which were immediate responses to the COVID outbreak. So some of the immediate responses is we were able to take over a couple of hotels and turn them into step-down beds to take people out of hospitals quickly. Very quickly set up a temporary mortuary in order to be able to cope with the increased demand that might be seen there. And also we set up, we were planning to set up on our contact centre and setting up more things like chatbots and also more self-serve. And we were able to accelerate that from sort of like a 6-month timeline on the project into 2 weeks. And that was with cooperation from, in all cases, with cooperation and collaboration with health partners and with providers and also with the staff. So we found things like user acceptance sign off was much quicker and easier. We found in terms of meetings, remote meetings were happening a lot quicker People arrived on time, and we finished usually earlier on the meetings, but decisions were made. So it proved quite beneficial in terms of the way that we were able to react quickly.
Yeah, I mean, a much bigger situation in your case than mine. But I mean, I remember there was nobody there. Everybody was on holiday, so I couldn't get great lumps of people together. And what we find was people like myself taking decisions above my pay grade.
Yeah.
And I know when the managing director came back, I went with trepidation on the door, and knocked on the door and said, "This is what I've done, boss. It's going to cost you more, but we'll get it back." Unfortunately, he said, well, he had no option except say tick, because otherwise his job would have gone as well. But I agree entirely. In other lesser situations, there is much more opportunity for teamwork these days because communication is so fast.
It's funny, isn't it? I mean, that was one of the mantras I remember from delivering continuous improvement techniques to the NHS. So one of the easy mantras was that, that common sense isn't that common. But actually, when you have a situation where you understand what the risks are and you understand the purpose and why you're there, common sense seems very strong to prevail for the decision making. And I think it seems to help decision making and action things much more quickly. Harnessing that is challenging when things become less pressured and we go back to transitioning and being seen to be making fair, informed, consulted decisions. It seems less straightforward. I mean, society is going to change, so it's going to change. People speculate how, but there will be changes in our attitudes, maybe even changes in our core values as a society. We're looking at the world a little bit differently from having this hiatus, this break, in living the norm. What do you feel? Either of you, what do you feel will be a prevailing challenge or change in value or behaviour for society going forward?
Well, I think the mere fact that we've actually recognised that there are a lot of so-called unskilled people who are actually quite skilled and totally undervalued. And I think that I hope that we will find a way to change that and make some of those jobs more understood as to what they're worth.
Yeah.
And that will change things. And letting people, because they're distributed, rather like we did in the paint job, make their own decisions rather than have it directed from above.
Yes. Yeah. Do you see that, Stuart? Do you feel that will be something that impacts your service provision as the council, or even the way the council makes decisions internally?
It's certainly something that we're aware of, and part of, if ever you're faced with a situation like this, you try and identify and hoover up any innovation or any advantage that it provides. And that's something that we're actually thinking about, is how do we maintain that faster, more empowered decision making through the organisation while maintaining the appropriate level of risk management, because obviously with the services that we provide, the end service user, the community, the individual, the risks can be quite catastrophic in certain cases. So we do have to make sure that we maintain that. I think, with our workforce, we've accelerated the organisation's capacity and also appetite for remote working, which I think we might be able to take advantage of in the future. And reduce the footprint, both in terms of office space, but also travel that will result in it. And I think in addressing all of those things, what we're going to have to work out, what we need to concentrate on, is how do we positively reinforce all the good things to encourage it to grow and flourish, as well as controlling some of the negative things, which will take us back to the old ways of working and in terms of decision making. And for us, of course, that makes it even more interesting because we have to take into the political dimension of working with the councillors and the impact on the decision making to make sure that they're fully engaged and fully aware of what's happening and how it's happening. One other quick thing is it has been interesting. One of the ways that we did respond was to try and alleviate some of the pressure on the front line. Was we were asking internally for volunteers as well. And a lot of the people that have gone and helped and supported on the front line, it's been a real eye-opener. And I was just thinking about your comment, Mike, in that people going and helping in those frontline difficult jobs are actually quite enthusiastic when they come out of it. And I think part of it will be getting people to challenge that perception of some of the domiciliary care work and some of the care home work is not as bad and as horrible as you might think, and actually it's very rewarding and worthwhile.
Yes, I agree. I mean, I think one of the problems, if this change is, well, the change is going to happen anyway, is for, and even more difficult in your sort of situation, but with people in power being prepared to let go of some of their power. Right. If we want this innovation on the lower people in the strata of any organisation to do their thing and use their skills, because they're the people who know about it, and they can come up with. And I found that in my days at Rover, one of the things I did when we had the relationship with Honda, and I went over to Honda, and I realised I hadn't, what I'd been doing for the previous 35 years was nonsense, and there was a different way of doing it. And we used to allocate jobs for going down the line, for example, 4 people doing this, and you specified it, and we give them times and whatever. When we passed that down to them, on average, the workforce reduced the times by 10% on anything us as industrial engineers could actually do. But it really made it very difficult for the senior supervision to say, but, who said you could do that? And it is going to be very difficult for middle management, particularly, to let the power go.
Yes.
I mean, that's always been the case. I'm sure you found that, Stuart, in your improvement programs. But
absolutely. And
this time it's going to be in spades.
Yeah.
Yeah. I think. When I was researching, the kind of systems required for self-care in the community, and we worked on that. You were involved in consulting in that area, Stuart. And one of the questions that arose for me that again, if it's a community you're working with, as with a workforce community, how do you reach the hard to reach? And I felt like that was a significant question that, I don't feel I ever bottomed that question out. If it's difficult to get engagement from certain people, it's difficult to know how to reach in to get that engagement. I think when I spoke with Sarah Ellis from the Royal Shakespeare Company, she observed that this sort of out to the community, the streaming and online demand theatre had opened up a whole new audience that wouldn't ever have normally gone to a theatre. And what maybe Sarah just cautioned against was, as we revert back, so the theatres will reopen, what her job was the theatre's going to take care of itself. The actors love it, they're going to create it, the audiences are going to come back. But what her role was really to make sure that those that had been included in this strange digital world remain included, so recognizing how that inclusion can be fostered going forward as the world sort of reinvents itself. The question, I guess, maybe to both of you is really who do you feel need most advocated for and protected to be able to, and how do you feel you will ensure that that inclusion going forward? It's a hard question, I know.
If I'll go first, Mike, and then you can hoover up afterwards. The interesting thing is, and I don't want to appear like overly optimistic as a result of this, but I think it does present us with a real opportunity, because with the services that the council provides, our focus has to be, with reduced budget, what we have to do is how do we make sure that we save the really value add face-to-face and hand-holding type contact for the most vulnerable and those that need it. And that there's a slight disparity or slight variation between the appetite and understanding of the people employed by Hampshire County Council about the adoption and use of technology against the various user segments. And it's not as simple as, doing segmentation based on demographics or geography or anything like that. It's down to the individual. And there are some individuals who are more than happy to use Snapchat or WhatsApp or something like that to maintain contact with a supporter or a community worker, but there are others that aren't and aren't capable. And it's about how you get that match and that mix so that you get the right and appropriate channel to help the right person. And I think in that way we'll be able to make our funding go much further to help more people. But it is that nuanced. It's down to that sort of level of almost CRM at how you provide and align your service to your service users.
And again, I mean, that's something, I mean, way back at the beginning of these talks, I spoke with Peter Lynham, and he talked very much about the importance of relationships. And I guess he was talking about the importance of relationships from individuals in one business to individuals in another. And here, I hear that importance of relationship coming from the actual service provider and those that you're providing to, and that devolvement of the decision making to them to determine the right way forward for each individual case.
Yeah, agree. I mean, there's all sorts of issues there about broadband in rural areas and so forth, and they're very disadvantaged, and they tend to be elderly too, and not so technologically savvy as people in urban areas, as a general rule. I mean, I think there's a demographic thing. I mean, us olders, will be gone within 10 years, and most of the people who are not savvy with using the smartphone and so on will have gone. The people coming through the next decade, they're used to it, maybe at a lower level, but how long's the mobile phone been in general use? I don't know. Is it 15, 25 years?
Yeah.
In general?
Guessing.
I'd hate to say when I got my first mobile phone, Mike.
Yes, well, it's a long time. Mine was I can't remember. But the point is, you go down to homeless people in the street, right? And many of them, younger people, will whip out their mobile phone. You go to the older people. I've got a 94-year-old neighbour, and computers, mobile phone. I can see they're useful, but I don't know how to use them, and therefore it's very difficult, other than face to face, to actually get your message over to them. Not because they don't want to know; it's because it's just too much effort for a lot of them.
Yes.
And so I think to some degree the problem will go away, but we've got maybe a decade when we've got to work on how do we do it. And knowing that we're going to have a hump of people we won't answer the question to. Actually dealing with that, how do we do it with the people who can't access it?
Yes.
I don't know the answer to that. I don't know if Stuart does either. I mean, all we can do is make sure it's right for the 90% who can adapt to it.
But and again, that's what I was alluding to about where we divert that resource to the most vulnerable and those that need it. So we have services, or try and get services, that are available for those that don't have access to the technology. But where, and even in the 90 age category, there are people that will use mobile phones and smartphones, have been taught. We've managed in lockdown to get my mum to engage with us on WhatsApp via video. And that's made a huge difference to her life. We do spend most of the time looking up her left nostril, but it's still quite an engaging conversation which she benefits from. And the really interesting thing about technology is if you think about how the mobile phone has changed from the Vodafone brick that I had back in the late 80s to the smartphones that we've got now. When the older generation are sitting at home comfortable with smartphones, what on earth will the younger generation have? Will it be implants? Will it be something else in terms of that technology? So we'll just adapt again.
Yeah.
Yes, my son is desperate to have an implant so that he can, open his curtains and do everything else while he's on the way home and stuff. So you're quite right. It will be a different world, and they'll be running at a different pace to the people we need to try and look after, which is very, very difficult. I mean, we're going to have, what, 15% unemployment for a period?
Yes.
Potentially.
Okay, I guess I'm mindful that I'm keeping you over lunch, so I'd like to chat to you for hours, but of course you've probably got stuff to get on with. So thank you very much indeed for sharing these insights. And that I find the insights I've gained from both of you over the time I've known you so valuable to help me develop my own practice and understand what's important to include in our programs to be able to bring them forward. And I will do that again with this insight that I gained from you here. For any students that are watching this, this is lovely secondary data they can use to inform their research. So thank you both very much for that contribution. And for the wider Warwick community, to inform and build that community is so valuable. And thank you very much indeed. After this series, I guess I'm going to reflect a bit and think about what kind of themes do I see coming out. So, I already can see there's some themes coming through from all the different insights I've gained. I think I can see something like compassionate leadership, I think, as a topic. I think I see that coming through very strong, and something that would be interesting to explore. I can see that inclusivity is a huge theme that's come out through this, that we can get better at and we need to get better at. And I think it would be interesting to explore how to get better at it. I think this big systems dynamics, I can see that the fact that your services, you've got so many different services there, Stuart, and they all will impact on each other. And that big system dynamic is something that would be, again, interesting to explore. And I see this, I have heard this word, you guys haven't mentioned it directly, but this idea of resilience, this idea that resilience is like the new sustainability. It's not about getting it right and keeping it right. It's about being able to adapt and flex and change and make the responses as required. I think digital has seemed to be revolutionizing the way we work. But I think what is to be understood there, or to be worked more there, is to understand the role of digital and to support the sort of cultural, behavioural, societal changes that we want to have happening. So I think it's got a supportive role rather than a leading role particularly. And then of course the other thing that falls out of that is the importance of creating the future. It's not the past now is going to change. However we live going forward, it will change. And to feel empowered, to feel we can create our new identities and we can create the future world that we live in, learning and understanding approaches to make that happen, I think is an exciting way forward. So never know, I'll be back in touch and knocking your doors to help inform some of those areas. But I think it would be interesting to then bring that back to the theoretical side of academia and ask them to look around those areas to bring some programs, some workshops, some classes forward out of that. I guess apart from thanking you both very much for closing the series and for supporting me and working with me over these years, thank you very much indeed. And I guess if you want to hear more from Stuart or from Mike, then you can of course contact me directly. I'm sure you can Google them and find them. Otherwise, you could follow the link on the closing slide. And if you want to, this series is available on a podcast. So just search on your preferred platform on Insights Over Lunch. Nothing more to be said apart from enjoy your lunch. Thank you both very much.
Thank you, Mairi.
Thank
Nice
you.
to see you again, Mike.
We've enjoyed working with you over the years.
Thank you.